To me, it seems natural that if you're in medicine, that'll be the first choice you would make as far as working in areas where people don't have access to health care.
Those people there, like I said, they saved my life. They really did.
When I started, there was nothing. I was the first employee here, and I had to sort of develop a program with a little bit of federal money. We were very lucky, and land was cheap in 1973. That's when we made the purchase of the land on Childs Avenue that had nothing but dirt on it.
As we started to grow, we started to expand. We expanded that building, and then more buildings and more buildings.
When I started, we had 6 sites. We have 26.
You know, in the early days of Golden Valley, it was very challenging. There wasn't a lot of acceptance of what we were going to do. People were a little bit, I would say, unsure of what our plans were.
When I first started here, the community, the clinic was the only one providing care for the patients, and everybody else didn't want to see those patients.
2 years old, huh? Sweetie, can we take a look at your pretty teeth?
I think Golden Valley really has had an effect on the community. If you just take the healthcare piece itself, we went from serving, I think, maybe 500 people in 1972 to today, in the last year, we served 100,000 individuals.
Here in Stanislaus County, we are the major safety net. We've kind of taken over more of that role, even than the county health center themselves, is we take care of those patients in their communities. Whereas we're out in Planada, La Grande, Wesley, Newman, Patterson, we're out in those communities where the patients are at.
What a better goal in life than to be sure that people have access to basic health care services.
The mission of Golden Valley Health Centers
Is to improve the health of our patients
by providing
quality primary health care services
to the people in the communities we serve,
regardless of language
financial
or cultural barriers.
People can be cruel when you're homeless. They look at you in a whole different light. You just think that really nobody cares for you.
I had lost 30 pounds in a short time, and I thought I had cancer. To my surprise, it was not cancer. I had become a diabetic. I didn't realize the seriousness of being diabetic.
I walked through that door one day just sick as a dog, and they didn't know me. But they didn't ask me for an ID or anything like everybody else did.
Coming to Golden Valley, you see people from all walks of life here. And it makes me feel good that there's a place to come to.
Golden Valley was the light at the end of the tunnel, and it wasn't a freight train coming at me, it was help.
To me, it was a place of refuge, because, you know, if it wasn't here, I wouldn't be here.
We serve very vulnerable populations, people that, you know, many other providers do not want to see because of the challenges they bring forward. So if you think about the kind of patients that we serve, it takes a special person to go that extra step to care for them.
But the people have always been great to me here. They've always accepted me and loved me and cared for me, so I continue to hang around here. As long as I get that feeling, I'm going to continue to hang around here.
stickers. You guys got stickers, okay?
You know, I can't think of many positions for a physician to work where you can take care of people that you know need the care and who appreciate it, and to work in an environment where you have such nice facilities and trained staff.
I went to medical school to come back to the Central Valley, to a community health center, to take care of the type of people that Golden Valley's mission is. Ever since I can remember, I wanted to be a doctor. I grew up in the Central Valley. I was born in Tijuana, Mexico. My parents were farm workers in the Central Valley. First, I loved medicine, and then secondly, it was the same people that were very similar to my mother, my father, my brother, my uncle, and that was my passion, taking care of my community, of my people.
I didn't expect to be here for 40 years. My gosh, who has that fortune and that opportunity?
I've been at Golden Valley Health Centers for 31 years.
9 years.
3 years.
5 years.
32 years.
1 year and 6 months.
5 years.
15 years.
3 years.
38 years full-time, 2 years part-time, so total about 40 years.
You know, I'm not really different than a lot of folks out there. You know, in one respect, I just did my job. I don't have any exceptional attributes about caring. I'm not Mother Teresa, and many of my employees will tell you that I'm not Mother Teresa.
Mike has always been a person that kind of inspires people.
He really surprised me because I really didn't think he was going to make this thing happen, and he actually did something.
Once he got a hold of that vision of what he really wanted to do and how he could serve the community better, he just never let go.
This beautiful senior center, that's his vision.
Our final building is the Senior Health and Wellness Center, which really is kind of an appropriate, kind of fitting way for us to complete the land here, because many of those folks were probably, some of them were using the health centers as either children or young adults back in 1972.
I love that we're doing things better over time. We're not stuck in the same old, that we recognize we can improve and that there is absolutely a lot of need for improvement in healthcare. I have a vision of healthcare that's focused on prevention, wellness, services that are connected, and really truly that everybody has a right to healthcare.
I'm one that the cup is half full, not half empty, and I'm hopefully optimistic that we are making changes, however sluggish and slow. I always would want these changes to happen overnight, but they don't take. They do take some time to make changes, caring for the underserved, caring for the poor, caring for those who have no other resources of care. As long as we do that, I'm comfortable that we're going to be here another 40 or 50 years.